All right. Good morning, everyone. My name is Konain Qurban, and I'm a PhD researcher at the University of Ottawa, and also the founder and CEO for Axon Health, an operations management and outcomes tracking platform specifically for sober living facilities. In my presentation today, I will be sharing with you guys three key principles. Each one of these principles are borrowed from a different domain, from a different country, or a different social setting. Yet they fit like a glove when we apply them in the context of connecting mental health with other systems of care. So I would just like to start by sharing some context. So, billions of dollars globally are being spent on housing and social programs. Yet, chronic homelessness, which is often tied to mental health and substance use, persists. In Canada alone, we have roughly 35,000 people each year who experience homelessness every night. And a massive 74% of them report of suffering from severe mental health or substance use related issue. So this points to a systems of failure rather than a lack of resources. So when frontline agencies they can't see the full picture, people often tend to fall through the cracks. So in my work across addiction recovery, homelessness support, and mental health services, one truth keeps repeating. Disconnected data becomes someone's relapse, someone's eviction, or even someone's crisis. This exact issue is documented in the homelessness Federated learning study that was conducted by the University of Calgary in 2023, where they showed that each agency's data alone was either too small, too fragmented, or too biased to detect who was at risk of becoming chronic or episodic homeless. But when agencies collaborated without sharing raw data, predictive accuracy jumped significantly. And that's the heart of the issue. The people who are most in need often exist across multiple systems, but those systems, they don't talk to each other. That brings me to the reality of the nonprofits. So most nonprofits are asked to do the hardest work. Complex mental health care, addictions, youth work, women's shelters, but using outdated or mismatched systems. We expect from them population level insights, but we give them the tools that barely support internal workflows, let alone cross agency collaboration. And when their funders request data in exchange for the funding, in exchange for the insights, my apologies, nonprofits, they panic, not because they don't want to help, but because sharing highly sensitive client data, it's either too risky, complicated, or even, or at times incompatible. So this brings me to the first principle I would like to share with you guys. It's called coordinated access. Now, at the start of my presentation, I shared that each one of the three principles, they're borrowed from somewhere. So this principle of coordinated access, this is borrowed from mental health agencies. This is something that mental health agencies could borrow from homelessness response networks. Coordinated access means agencies can see what's available across the network. Open beds, supportive housing spots, treatment programs, detox openings, culturally informed supports, and so on. However, there's an underlying challenge with the traditional coordinated access models. They assume let's build one giant database, and then every agency they upload everything in that. Like for example, in Canada we have HIFIS, which is a free central database sponsored by the government. But the problem with HIFIS-like systems is that they create privacy and incompatibility risks. They create power imbalances, thereby discouraging participation. So again, citing the homelessness study that was done in the University of Calgary in 2023, they found that smaller agencies, especially the ones governments need data from, like the violence against women shelters or faith-based program shelters, they were often unable or unwilling to centralize data, resulting in inaccurate or inequitable population-level insights. So coordinated access can only work if we adopt the same approach successful AI researchers are using. And this brings me to the second principle I would like to share with you guys, federated data governance. This is a principle which mental health agencies could borrow from educational networks in the US. Federated data governance means agencies collaborate without ever giving up control of their data. Think of it like a WhatsApp group chat where everyone participates without having to share a phone. Everyone keeps their own device, their own data, but they agree on shared rules about what can be safely exchanged. And finally, I would like to share my third and last principle, which is federated learning. Together with federated data governance, it forms the federated systems. Federated learning, so once the shared rules about the data exchange are established across the agencies, an AI training method is applied which allows agencies to collaborate without ever giving up their control of respective databases. And this AI training method is what we refer to as the federated learning. This federated learning concept, it's borrowed directly from applications in the US, particularly in medicine, where hospitals train an AI model without ever pooling patient data. And in AI theory, researchers describe federated systems as the only viable solution for high-risk, highly private domains with disjointed infrastructures. And this is exactly the environment nonprofits are in at the moment. So why is this important, you might ask? So federated governance solves the biggest trust and privacy barriers preventing real collaboration. They have shown to achieve, and this is something which is cited from academic studies, 99% of the accuracy of a centralized model without ever sharing raw data. The performance improvement was most significant for smaller agencies, the ones who usually get left behind in centralized approaches. So federated systems, they reduce risk because only the minimum necessary information is exchanged under shared rules rather than the full client profiles. Here's the simple idea behind federated systems. So each agency, they keep their own data wherever it already lives. For example, its EMR, its CRM, intake system, or even a spreadsheet. Then agencies, they agree on shared rules about what can be safely shared. And this is the whole federated data governance framework. And then a federated layer sits on top and it allows agencies to answer shared questions. And this is the insight that we are typically most interested in, which is insights like how many beds are open, who's at risk, which services are available, and which populations are waiting the longest. Crucially, this is not raw client data sharing. This is aggregate, permissioned, purpose-bound data sharing governed through shared rules. So, federated governance and federated systems, they improve outcomes because it enables, speaking again from nonprofits' perspective, faster referrals, which in their speak, it means fewer people lost between the transitions. Stronger privacy. This makes agencies of all sizes and types more willing to participate. And real-time coordination, which means that speed matters when someone is at risk. Ultimately, when data trusts are built, people trust the system again. Federated governance or federated systems is more than a technology. It's a mindset shift. It allows organizations to stay independent, yet still be able to collaborate. And when systems talk safely, people, of course, they don't fall through the crack. Finally, I always say that if mental health and housing and community services, they're the front line, data is the thread that binds them. So let's make that thread smart, safe, and shared, and not centralized. because federated systems is how we finally connect care without ever having to compromise trust. Thank you so much for listening to my presentation, and here are my contact details. I would urge you, if you want to learn more about Axon Health and what we're doing in the space of federated systems to enable coordinated access, please do reach out. Thank you so much.